Government Scientific Advisor. Let me start by reminding everyone about our step-by-step action plan to defeat coronavirus. At every step of this process, we have followed the latest scientific and medical advice. Our goal is to slow the spread of the virus and protect the ability of the NHS to cope. We've taken unprecedented action to increase NHS capacity with more beds, more staff, and more equipment on the front line. And we've told people to stay at home so that we can protect lives and protect the NHS. Today's daily figures show that 232,708 people in the UK have now been tested for coronavirus. 60,734 people have tested positive, an increase of 5,492 cases since yesterday. 19,438 people have been admitted to hospital, and sadly, of those in hospital, 7,097 have now died, an increase of 938 fatalities since yesterday. Our thoughts are with the family and friends of those who have passed away. People, I'm sure, will also want an update on the Prime Minister's health. He is receiving excellent care from the NHS team at St Thomas's. The latest from the hospital is that the Prime Minister remains in intensive care, where his condition is improving. I can also tell you that he has been sitting up in bed and engaging positively with the clinical team. The Prime Minister is not only my colleague and my boss, but also a friend, and my thoughts are with him and his family. The news about the PM reminds us how indiscriminate this disease is. Nearly everyone will know someone who's been affected: friends, family, neighbours, colleagues. This is a terrible virus that respects no boundaries of status or geography or vocation. But we are not facing it alone. We are all taking part in a collective national effort to protect the vulnerable and each other, to secure our public services, and to save lives. This endeavour is underpinned by an important, simple idea: that we depend on each other. When you need it, when you fall on hard times, we will all, as one society, be there for you, to take care of you until you are once again ready to take care of yourself and others. This idea has been central to all of our efforts to support people and businesses during this crisis. We promise to do whatever it takes, and I am striving every day to keep that promise. But when I say we all depend on each other, I don't just mean the relationship between individuals, businesses, and the state. One of our greatest strengths as a country is our civil society. The local charities who provide so much compassion, care, and community to the most vulnerable in our country. You have not been forgotten. British people, businesses, and foundations are already doing their part to support our charity sector. And today, we in government will do our part as we build on our plan for the economy with a plan to support our social fabric. There are nearly 170,000 charities in this country, and the truth is we will not be able to match every pound of funding that they would have received this year. Charities can already use many of our existing schemes to support people and to protect their staff. All charities are eligible for the Job Retention Scheme, and in line with medical advice, and just like any other employer, the right answer for many charities will be to furlough their employees. But some charities are on the front line of fighting the coronavirus, and others provide critical services and support to vulnerable people and communities. For them, shutting up shop at this moment would be to contravene their very purpose, their entire reason to exist. Those charities have never been more needed than they are now, and they've never faced such a sudden fall in their funding. So today I am announcing £750 million of funding for the charity sector. £370 million of that funding will support small, local charities working with vulnerable people. We all know who they are. Those small charities in our villages, our market towns, in pockets of our cities. The unsung heroes looking after the vulnerable and holding together our social fabric. In England, this support will be provided through organisations like the National Lottery Communities Fund. And we will allocate £60 million of this funding through the Barnett formula to Scotland, Wales and Northern Ireland. The UK government will also provide £360 million directly to charities providing essential services and supporting vulnerable people as we battle the coronavirus. Up to £200 million of those grants will support hospices, with the rest going to organisations like St John's Ambulance and the Citizens Advice Bureau, as well as charities supporting vulnerable children, victims of domestic abuse or disabled people. And last night, the BBC announced their Big Night In charity appeal on April the 23rd. And today I can confirm that the government will match pound for pound whatever the public decides to donate, starting with at least £20 million to the National Emergencies Trust appeal. 2 short weeks ago, I spoke of the need for kindness, decency, and the sort of neighbourliness that is at the heart of these charitable and community efforts. The normally invisible connections between us have, in recent weeks, become more apparent. For most of us, we spend our lives oblivious to these connections, these bonds, and how our behaviours, however small, can have a dramatic effect on others. But these bonds are not invisible for our local charities. For the volunteer keeping victims of domestic violence safe. For the outreach worker helping a rough sleeper find a bed. Or for the support worker manning the phones to help stave off the heart-wrenching loneliness so many of our elderly relatives and friends will be experiencing right now. These connections might be hard to see, but they are there, and they are strengthened by our compassion for others. Charities embody this like no other organisation. And their lesson is that the simplest acts have the potential to change lives. At this time, when many are hurting and tired and confined, we need the gentleness of charities in our lives. It gives us hope. It makes us stronger. And it reminds us we depend on each other. Thank you. If we could now take some questions, I believe. Angela, were you going to present your slides first?
If I may.
Perfect.
I wanted to start by showing this data, which is a record of how much we've acted together to reduce how much we contact each other. So what's shown here is footfall at 17 stations across the country, counting how many people pass through those stations at different times through the month of March. And what you see is that at the end of March, footfall was down 94% compared to the first week of March. And in the next slide, what you can see is that that has worked in the sense that this count of new cases in the UK, day by day, over the last few weeks, is not accelerating out. Yesterday, there were 5,492 new cases, and the spread of this virus is not accelerating, and that is good news. If I could have the next slide, please. What's recorded here is people in hospital beds with COVID. And the highest of those lines is London, and the one just below in grey is the Midlands. And what this is a slower responding record of new infections, because of course once people are in hospital, some of them will have to stay there for many days, some of them for some weeks. But again, what we see is that the rate at which this is rising is definitely getting slower, and it looks like we're beginning to get towards a flat curve there, which is of course what we've all wanted. Our overall aim has always been to make sure that everybody can have access to critical care if they need it. And that's what's shown on the next slide, is COVID patients in critical care. Back one, please. Can I go back one, please? No? Okay. This one here. Yes, thank you. And there we can see encouraging news that perhaps, at least in some parts of the country, this really has started to flatten. Across the country, in the last 24 hours, this has increased by just 4%. And again, that is good news because this is our most limiting resource at the moment. So finally, I have data on the sad statistic of people who have died from COVID. And this is an international comparison across different countries, showing how that number accumulates in different countries. And the UK is the dark blue line somewhere in the middle there. This data has long reporting lags, and even after the number of people in critical care stabilises or even maybe begins to fall, this number will rise because sometimes deaths are reported many, many days or even a week or so after, sadly, somebody has died. So we expect this number to keep rising even after the curve has flattened. Thank you, Chancellor.
Thank you. Steve, anything you wanted to add?
Well, maybe a word on charities. So in the NHS, we work very closely with our partners in the charitable section. And I know it's really important that not only we all support them during this difficult time, but it's also really important to recognise the support that they are giving everybody to help them through the time where we are asking people to stay at home and take the measures that we have indicated. I have the real privilege at NHS England of leading the cardiovascular, that's heart attacks and stroke strategy, and two charities I work very closely with, the British Heart Foundation and the Stroke Association. And I know they would want me to say today, to remind everybody that the NHS has worked night and day to surge capacity to manage coronavirus, but it is also there for you if you have symptoms of a stroke, symptoms of a heart attack. Indeed, if you have any emergency condition, whether it's a sick child, whether it's a mother or a pregnant mother in pregnancy who's worried about the movements of the baby, you should be seeking emergency services, just as you always have done. They are there for you. And although we are focusing on coronavirus, it's important that we also continue to focus on other conditions.
Thank you, Steve. If we take some questions, I think first up is Laura Koonsberg from BBC.
Thank you, Chancellor. You keep saying whatever it takes to help people through this time and with support from the economy. But do you accept, Chancellor, that under the lockdown there is a trade-off between protecting people's health and protecting people's jobs?
Thanks, Laura. Well, I think we've been clear. Our priority is to protect people's lives, their health and well-being. That is our absolute overriding priority. But alongside that, in a coordinated, I think, coherent and consistent fashion, we have also put in place unprecedented and significant measures to protect people's jobs, their incomes, their livelihoods, and indeed the businesses that employ them. I think that's the right approach. And what it does is means that we can mitigate as much of the economic impact as possible and ensure that as soon as we can get through this, that we can bounce back as quickly as possible. Was there anything you wanted to follow up on for either of anyone else?
I mean, do you accept, though, that some people are falling through the cracks? I mean, the Treasury Select Committee this afternoon has said that you need to take urgent action for some people who aren't covered by your very extensive scheme. Do you think the public should be prepared for a serious downturn, maybe even a recession?
I think I've been very clear and very honest that this will have a significant impact on our economy. That's not uncommon with every other major country that's grappling with this. I think we will all see a significant impact on our economy. And I've also been very honest that in spite of our unprecedented measures in scale and scope, I can't stand here and say that I can save every single job, protect every single business, or indeed every single charity, the focus of today's announcements. That's just simply not possible. But what we can do is put in place what I think is an enormous amount of support in a targeted fashion as best as possible to help as many people as possible get through this so that, as I said, we can emerge on the other side of it stronger, united, and hopefully able to bounce back as quickly as possible. Perfect. I think if we turn next to, is it Tom Clark from ITV? Tom, are you there?
Hello, yes I am. Thank you, Chancellor. My question relates to testing. Yesterday's briefing, the Chief Medical Officer made the honest admission that Germany's lower death toll in their pandemic is due to their ability to test more people more quickly. Given their death toll is 3 times high, more than 3 times lower than ours, is it now time for the government to come out and admit that thousands of people have died and thousands more people will die in this country as a result of our failure to test more people more rapidly?
Steve, you want to take the
to be honest, I don't think that's what the Chief Medical Officer did say. I think he said that testing was one of many factors, and I think the Chief Scientific Advisor spoke about this too, was one of a range of things in Germany, and I think it's difficult at this stage to say what range of factors has contributed to what. I think the Chief Medical Officer was also making clear that it's important that all countries learn from each other. And I've no doubt that other countries will want to learn from our experience and some of the things that we have done in the United Kingdom, for instance, the work on modelling and predicting what the epidemic might do. So I think the point he was making yesterday was that everybody should be learning from each other, and indeed that is what we're doing. Angela might have more to say on that.
Yes, I would have thought the point would be that the rate of deaths, of course, appears much lower if you can count many, many more of the cases. That's certainly one of the things that you see. If you see different case fatality rates in countries, that could be because you're counting many, many more of the people who should be on the bottom of that fraction. In terms of modelling, that is something that we're really very happy in this country to offer to other countries, and hope that's one of the things we can contribute to the international effort.
Great. Thank you, Tom. I hope that.
Like you, I just sat through the Select Committee hearing on which you were a witness. We heard from the people in charge of testing in South Korea and in Hong Kong, who made it abundantly clear testing has reduced the numbers of cases of coronavirus in those countries. And Dr. Whitty did say yesterday that it was in fact Germany's ability to test that was, yes, part of their lower death rates, and that we had less concern. He did not dispute that. It is about testing. So can you tell me whether our inability to test will lead to greater mortality here? And can I also follow up, how dependent is the UK on a testing regime for us to be able to lift lockdown restrictions? And are we on course to have sufficient levels of testing in the community to allow us to do that in anything like the next 3 or 4 weeks?
So I think we all agree that testing is important. That is not the issue at all. I think the point I was making is that testing is one part of a set of different things that will need to be considered in any country's strategy. That is the case here. It is the case in Germany. And I have spoken to the Chief Medical Officer today, and I think, I know the point he was making yesterday was it is a part of the overall strategy. And I think it is almost certainly too early in all countries' experience to know exactly which components of strategies have been the most effective or have been most important. And it's highly likely it's the combination of these things rather than any individual part of an approach.
Okay, brilliant. Thank you, Tom. Can we turn to Andy Bell from Channel 5?
Yes, thank you. And I want to follow up partly on Tom's question about the lockdown, but in a different context, which is the First Minister of Wales has said today that, as far as he's concerned, the lockdown is going to continue next week in Wales. So can you level with us now and just accept that the lockdown is going to continue across the UK through next week? And from a scientific and medical point of view, is it possible or even desirable that different parts of the country could come out of lockdown at different speeds?
Yeah, let me address that before handing over, Andy. I can just say, look, there will be a COBRA meeting tomorrow chaired by the First Secretary of State involving the devolved administrations to talk about the approach to the review. We committed there would be a review in and around 3 weeks. That review will be based on the evidence and the data provided by SAGE, which will only be available next week. But I think rather than speculate about the future, I think we should focus very seriously on the here and now and the present. And I think there the message is unequivocal. Our priority right now is to stop the spread of this virus, to get the other side of the peak. And the best way to do that is for people to follow the advice, which is to stay at home, protect lives and protect the NHS. So I think in terms of messaging, I would want to be absolutely unequivocal about that. That's where we are now. That's the advice people should be following. That's the best thing that we can all do to help get through this as quickly as possible. But I don't know, Andrew, if you wanted to add anything on that.
We have always said that we would need to be able to see what impact the whole suite of interventions that were brought into place on the 23rd of March are having before we can make any evidence-based decision on what to do next. And this week is a really important week. We're all watching what happens. I guess from a purely scientific point of view, more data is better for us. But I completely agree with the Chancellor that what really matters is that people stay home, protect lives, and save the NHS, or is it the other way around?
Brilliant. Andy, Hope, does that answer your question?
I'd just like to come back to the idea of whether different parts of the country could theoretically emerge at different times from lockdown, whether that's, first of all, politically possible, and secondly, whether that's in any way scientifically or medically desirable.
I think what I'd probably say before handing over to Angela on the medical is just, I think, again, I don't want to start speculating about the future. I think that's not helpful at this juncture. I think the thing now is for people to focus unequivocally on the advice. We are where we are in this process, and the advice is clear. People should follow the advice. That's the best thing that everyone can do wherever they live in this country at the moment. And I think Angela probably would echo that. But
I would echo that. I don't want to get into hypotheticals about what might be better one way or another. I suspect that simple strategies might well turn out to be the best to use, but we'll see. And I'm going to get it right this time. The advice is for Easter weekend to stay home, protect the NHS and save lives. So I will certainly be having my Easter at home.
Thank you, Andy. Gary, give me more.
Thank you. Chancellor, can I ask you, we've had unemployment figures from one European country so far post-COVID crisis, Norway, unemployment well over 10%. From the data you look at in the Treasury, can you hand on heart say we're not going to see something like that here?
No, Gary, I will be absolutely honest. This will have a significant impact on our economy, and not in an abstract way. It will have an impact on people's jobs and their livelihoods. And that's why we've taken the actions that we have in order to help mitigate some of that. I believe that, for example, the jobs retention scheme, the furlough scheme that we've put in place, which we've never had anything like in this country. As I said when I stood here to announce it, the government is stepping in to help people, to help pay people's wages so that they're not laid off, so they don't end up being unemployed, that they remain attached to their company, with a very significant safety net behind them. That helps the company, that helps the person, it helps their family finances. I think that, and to combine with all the other measures we've taken, will significantly help mitigate some of the impact. And I think that's what other commentators have said as well, that if we weren't doing all the things that we're doing, if we weren't put in place these unprecedented measures, it would certainly be worse. So I believe we're doing the right things. I can't stand here and say that there isn't going to be hardship ahead. There is, which is why going through this together as one society united, understanding that everyone's got a role to play, whether that's government, business, charities, your next door neighbour, I think that's the best approach to this. But I'm confident we will get through it.
Can I ask, is some of that, is some of the data from surveys already coming in outstripping your expectations? You mentioned the furlough scheme, some suggestion that there could be people applying for that, businesses applying for that way in excess maybe of Treasury expectations. Did you ever think you could be forking out, say, 40 billion over 3 months, which could be the number, couldn't it?
Well, I think just to clarify on that, we have not put out a specific projection or an estimate of the take-up of that scheme. And I think there was some reporting that we might have, and this might be in excess of it. So we haven't actually done that for the simple reason, this is an unprecedented situation. So of course we have a range of scenarios that might come our way, but there isn't a precise central estimate of what the scheme might do. What I would say is, you're right, there is other data that we can look at, and I think others and myself have talked about universal credit claims, which have come down from where they were 10 days ago, which is comforting, but they're still very elevated relative to what normal levels might be, sometimes 4 or 5 times higher. That is obviously something we look at, and that's why we've not only strengthened the safety net and put extra money to the tune of £7 billion plus into the welfare system through this, and then can bounce back quickly and provide security to those people and their families during it. Thank you. Is I think next Pippa Creer at the Daily Mirror.
We all know that the focus now is currently on following the advice, rightly. But I've spoken to head teachers and parents and MPs who are very keen to reopen schools as soon as the scientific advice suggests that it's safe to do so. So could I ask Professor McLean whether, despite the focus on the advice now, whether she could give us any indication of whether schools might reopen before the summer holidays, which after all are 3 months away. And the Chancellor, if I could ask you, how significant a factor are schools in your discussions about getting the economy back on its feet once we're through the other side of this?
I'm happy to answer that by saying there's very intensive work going on to think about all sorts of different things that we might do in the next stage. It would be completely premature for me to give a yes or no answer to that question, because so much depends on this question of how well have the measures put in on March the 23rd worked. And we can't know that this week until we see a longer run of infections that have happened since that time. But please be assured that people are working incredibly hard to explore those sorts of questions.
Yeah, and Pippa, I probably can't add much to what Angela said. Is that we are in all these instances we are driven and basing our decisions on the science and what is best for controlling the spread of this virus and getting that R0 number down. That's been our approach to this thing all along, and that will continue to be our approach. And I pay tribute to those who are helping keep our schools open for the children of key workers. That is valuable, and the work that they're doing is, I believe, well supported by the Department of Education. But again, they also are owed our thanks for doing that, because that is vital at this time.
Can I come back?
Yeah, of course. Yes.
I mean, I can understand that obviously the data and the science suggests that it's too soon to say, but Mr. Paris was talking just days ago about green shoots and the beginnings of signs of the curve flattening. Was that premature?
No, I don't think so, because I think what I said last week was that the green shoots were occurring in some of the early things that we were seeing, such as the reduction in transport, the reduction in footfall that we describe in these press conferences, which recognises that the British public is complying with instructions, and as we've said, the message is we need to continue complying with those instructions on social distancing. So those green shoots over time translate into benefit in a reduction in the number of infections, a reduction in the number of hospitalizations, and then sadly, finally, into a reduction in the number of deaths. And I think, as you have heard from Angela at the start of this press conference, we are starting to see a plateauing, the first signs of a plateauing of infections and hospitalizations. And if we had taken those measures, if people had not complied with them, we would not be seeing that. We would be seeing an exponential curve and a set of graphs that were steeply rising. We are beginning to see the benefits, I believe, but the really critical thing is that we have to continue following instructions. We have to continue following social distancing, because if we don't, the virus will start to spread again. And if it starts to spread again, then in a week or two's time, we will be seeing a set of figures which are not going in the direction that we want to see them. We will see increased pressure on the NHS. We will see increased numbers of deaths. So this is not the time to become complacent. It's not the time to think that the job has been done. This is the time to continue everybody continuing, whether you're me, whether you're a member of the public, frankly, whether you're a football team, to continue to keep with social distancing and ensure that the hard work and the hardship that everybody is no doubt encountering leads to those benefits. That's a simple message today, and you've heard it time and time again, and there are no apologies for giving it.
Brilliant. Thank you, Pippa. Can we go next to, is it Mesa Hall from the Express? Oh, no.
Yes, thank you, Chancellor. Just back to your job retention scheme, the head of Revenue and Customs has today warned that the scheme is open to fraud and abuse. Have you had any evidence that that is happening? And would you urge employees to blow the whistle on firms that may be abusing this scheme?
Yeah, thanks. Look, what I would say is we're obviously designing schemes at pace, which haven't been done before. And part of the reason that we've made some of the decisions that we've made in the design of whether it's the job retention scheme or the self-employed are deliberately to counter fraud. Because obviously we want to make them as simple as possible and as accessible to as many people as possible whilst protecting the taxpayer, because ultimately this is all of our money that will need to be paid back at some point. So we want to make sure it's targeted on people who really need it. And that has actually influenced some of the design choices we've made. That means some people might fall between the cracks. It means that there are people who are saying, well, can you not do it this way? Can you include us? And the reason we've not been able to do that is to protect against exactly that. Exactly the risk of fraud or spurious claims that we won't be able to verify, or only verify with a very cumbersome manual process which would delay the scheme's implementation, which I think is not the right thing. So, I'm confident that the decisions we've made will minimise the risk of fraud. Obviously, the team are hard at work at the moment getting these schemes up and running, and we will have as robust verification and auditing processes as possible to ensure that there isn't fraud and that we can go and tackle it. But that's why we've made some of the choices we've made, and hopefully that people will understand that, and they hopefully have been reasonable about that when I've explained, well, this is why you had to be employed, for example, on this particular day, because if you weren't, then obviously there is the risk that you could create a brand new employment for someone who we've never heard of before and suddenly start getting money from the taxpayer for not a genuine case. So that's, for example, one of the reasons we picked a cut-off date of February the 28th for that particular scheme. A big part of that was preventing fraud. So, hopefully that's clear. And Jim and HMRC and his team are doing a fantastic job getting these things up and running. I think he talked a little bit about timing, and we're on track to deliver against the timelines that I outlined earlier, which is pleasing because this is a huge challenge for them, and they're doing a great job. I hope does that answer what you wanted?
Thank you.
Perfect, thank you. James Tapsfield, Mail Online.
Thank you, Chancellor. Churchill had a personal doctor and President Trump has a medical team, but the Prime Minister was left with persistent symptoms for over a week and was only admitted to hospital after a video call with a GP. There doesn't seem to have been a great deal of social distancing going on in Downing Street. Haven't we failed to protect our key decision makers? And what needs to change for the future? Should we be more of a US-style system with more protection?
Well, I think I'll defer to Steve in a second, but I would say that I think the Prime Minister has received excellent care and advice at every step of the process. At the end of the day, no matter, we're all trying our absolute best. That none of us are superhuman and impervious to getting sick during this process, and that's what makes this whole thing so awful for all of us. But as I've observed and seen, the advice, the care has been excellent, not just beforehand, but especially now at St Thomas's. I don't know, Steve, if there's anything you want to add?
I'm absolutely confident the Prime Minister has and is receiving excellent medical care. I'm not his physician. He will have been advised by his own doctors, but I do know colleagues at St Thomas's Hospital. In fact, a couple of weeks ago, I took the opportunity to visit St Thomas's Hospital, visit some of the critical care consultants, and I can't tell you how impressed I was, and this is going back a few weeks, at the preparations that they were making, the details that they were thinking through in terms of how they would deal with increase in patients with coronavirus. They are amongst the best critical care clinicians in the world. St Thomas's, even when I was a junior doctor many years ago, was world renowned for its critical care capacity. So I'm absolutely confident that my colleagues, all the clinical staff, doctors, nurses, and everybody else at St Thomas's is providing exceptional care.
Brilliant. Thank you, Steve. Does that answer your question?
I was just going to say, the point on the Downing Street social distancing, in hindsight, do you think that that could have been more rigorously observed earlier?
Well, I think, look, everyone is doing their best to follow the guidelines. I mean, whether it's, Cabinet, we've conducted, I think for the first ever time, meetings, via alternative means, and people are appropriately following all the guidance. That doesn't mean that we can completely eliminate the spread of infection in this process. But I think the good news is, as I said, there's good update on the Prime Minister's position. Those that have been away are many of them now returning to work. But I think whether people are away or socially distancing or physically in the same place, the business of government throughout all of this has gone on, and it has gone on at pace. And the team, whether it's politicians, cabinet ministers, civil servants, doctors and medical advisors, are working night and day to make sure that we do what we need to get the country through this and support the British people at this time. I can absolutely give you that assurance. Thank you. Can we turn to Tim Ross from Bloomberg? Tim, you there?
Hello, yes. Chancellor, you say the Prime Minister is improving. Do you expect to see him able to leave hospital next week sometime? What are your expectations there? Also on Brexit, Chancellor, you have said before that you're very honest about the risks to the economy and the fact there will be a really significant impact, potentially a recession later this year. Do you really think it's a good idea to leave the European Union if the UK economy is in or just coming out of a very deep recession? And then to your two colleagues, the decision on whether to persist with the lockdown measures will be taken, we think, you're saying next week, probably sometime. What will the full range of data that you're analysing be in order to take that decision? And are we at the beginning of a peak now? How far off is your best guess?
If I could start, I think, you talked about, should we still leave the European Union, I think. I mean, we have left the European Union. That has happened. What we're doing now is just negotiating the final terms of our trading arrangements. That work is carrying on. And David Frost, the Prime Minister's chief Sherpa in this regard, held talks earlier this week with the deputy counterpart over at the EU. They've exchanged legal text. They've set out some clarifications that they both wanted from each other. And indeed, I think David is talking to his direct counterpart either later this week or next week to plan the next steps for the meetings and continue negotiations over April and May. So I think we remain committed to the timeline of concluding those talks and negotiations. That work is happening, albeit over video conference rather than in person. So I think that's a pretty clear statement of where we are on that. I think Angela, do you want to take the question on the...
Yes, very, very happy to take that question. So one of the great strengths of the kinds of mathematical modelling that SAGE is drawing on in order to give its advice is that it lets you pull together information from all sorts of different data streams. So my colleagues who are generating that advice will be using hard data on things like numbers of people arriving at hospital, numbers of people having to be admitted to critical care in hospital, but also things like that data on how many people are there in stations, survey data, asking people, well, precisely what behaviours have you toned down in the last few weeks? So I could actually bore you by telling you how many different data streams are under consideration, but that is the strength of that approach, is it lets you take a lot of different kinds of information and do the best job you can of synthesizing them together in order to understand the situation we have been in the past that has brought us to where we are now, and then do what you can to project into the future what's going to happen next. But I'm not going to do that right now because that's something that we do in a rather formal process. The modellers come to SAGE, and then SAGE puts that together, and we send it over to our politicians in order to make decisions.
Steve, anything you wanted to add finally?
As you know, SAGE has been publishing its material, so that is available. And I think also to add that many of the academic groups that contribute to SAGE publish their own research and modelling independently. And so that is there for all to see in terms of those key academic groups.
Brilliant, thank you. Well, if I could possibly wrap up, thank you, Tim, for that. And just say thank you to Angela, thank you to Steve for answering questions. Our announcement today was about supporting charities who are a critical part of the social fabric of this country. It builds on the economic plan that we've already announced to protect people's health and economic security by supporting public services like our NHS, backing business, and protecting people's jobs and incomes. And if I could conclude by saying this, our economic plan and the plan for charities that we announced today are built on one simple idea, that we depend on each other. Thank you.